Hi everybody, Dr. Sia here from the Dr. Sia channel. Now, it's no secret to a lot of people out there that I am an absolute enthusiast of intensive short-term dynamic psychotherapy. That's ISTDP. I really believe that this is an extremely effective therapy, and in this video today we're going to be talking about 3 reasons why ISTDP is an extremely effective therapy. Let's get started. All right, let's take a look. Sorry, I just touched the camera there. Let's take a look at 3 reasons why ISTDP is so effective. All right, one reason that ISTDP is so effective is that it doesn't just look at reducing symptoms. The second reason why ISTDP is so effective is that it helps you identify your defenses. And the third reason why ISTDP is so effective is that it's intensive and it's here and now focused. So those 3 reasons are 3 really good reasons for why ISTDP is so effective. Let's take a look at the first reason. So the first reason we talked about is that it's not just symptom focused. And you might be wondering, well, why does that matter? All I want to do is to go to therapy and reduce my symptoms. Now, for a long time, research has been telling us that the way that therapy should tell us or show us that it's effective is that it can reduce our symptoms. And surely enough, for a long time, through a lot of science and a lot of research, therapy has become very effective at just reducing our symptoms. Patients' symptoms get reduced, they feel better about themselves, they go home, and all is well. Now, my experience is, after 10 years of doing therapy, after 10 years of providing therapy, that what happens is people who get symptom reduction just cycle back. And what I mean with cycle back is their symptoms reduce in one area of their life, and then symptoms pop back up in another area of their life. So what happens is they come in with you and you reduce their social anxiety by just reducing the symptoms in the social situation, and then it pops back up into their relationships instead. It goes away from their relationships and it pops back up at work instead. Goes away at work, pops back up as soon as life changes a little bit. So that's why I think we can't be focusing on symptom reduction, because when we just make symptoms go away without making long-lasting change to the person and what happens within that person, symptoms are just going to pop back up again. And I think that science is starting to show more and more that that's the case. We used to do in psychotherapy, we used to just check to see, all right, we got some symptom reduction. Let's take a look to see if the person has symptoms in that same situation again a year later. And sure enough, we found that the person did not have symptoms in that situation again. But what we didn't look for, and what we're looking for more and more today, is does reducing symptoms equate to a person feeling happier in life? That they're actually enjoying life more, that they're flourishing more in life, that they're actually benefiting more in life? And we found that's not the case. Reducing a person's symptoms does not make them happier. Making a person happier makes them happier. And that's why I think that any good therapy, any really effective therapy, should be focusing on more than just symptom reduction. And ISTDP does just that. ISTDP focuses not just on you as a person, on your patterns, on your relationships, on what's in your background, on what's going on for you. It focuses on, its emphasis and focus is on getting you to feel like you are better able to cope with the horrors of life, with the terrible things in life, but that you're also able to fully enjoy and and flourish when life is going well. So it helps you really feel more positive about everything that is positive in life, and it helps you buffer more against those really negative things that happen in life. So that's my number 1 reason, or one of the reasons why ISTDP is so effective. A second reason why ISTDP is so effective is that it helps you identify your defenses. Most other therapies, and I would almost say, actually, all other therapies, non-psychodynamic based therapies, Am I lying now? Are there any other therapies? I think Gestalt also helps you look at some of your defenses. Anyway, most other therapies do not help you identify your defense mechanisms. Now, why is it so important to be able to identify defense mechanisms, and what are they? I won't go in fully into what defense mechanisms are. There's another video and I'll link that here and you can click on that if you don't know what they are. But defense mechanisms are essentially things that we do, things that we say, things that we think when we get anxious. So when something inside of us is anxiety provoking, when a feeling that we have, a thought that we have is anxiety provoking, we engage in certain defense mechanisms to reduce our anxiety about things. For example, a person who has a lot of difficulty with the idea of being sad might then instead intellectualize when they're getting sad. So it might be something really bad happens, maybe their dog dies, and instead of grieving, they might be going, well, you know, there's plenty of other dogs out there in the world, so I don't really need to be sad about my dog that I've had for 20 years, and it was basically my best friend. You can see there, the person trying to look at the obvious fact that there's a lot of dogs around is trying to reduce their sadness. Now, other therapies don't help people identify these defense mechanisms. And what happens is, when we help people identify what these defense mechanisms are, they learn so much about themselves and how they tend to operate. This becomes such useful information about how other people perceive them. There's something called the Johari window, where it's like you know yourself, but you never fully know yourself. Other people also know things about you that you don't know. You know things about you that sort of are seen, but there are things about you you don't know that are never seen. In therapy, in ISTDP therapy, you can help discover what those things are. Your therapist will tell you. A lot of other therapies, they'll just sit there in silence, maybe perhaps even identify, they're not really trained to, but they might identify some of these defenses, but they're trained to just let them go, don't do anything about them. In general, it's called rolling with resistance. So it's just like, let's just not notice that that happened. Let's just not look at that happened. With ISTDP, every single one of your defenses is mentioned so that you have the opportunity to evaluate them and consider whether it's something you want to hold on to or if it's something that you want to overcome. So an example would be in ISTDP therapy, I'd say to a patient, did you notice what you did there, that you sort of intellectualized when you were talking about your dog dying? Did you notice that you did that? And the person might say, no, I never noticed that I do that. Have you heard that before? People telling you that you seem like you're always just like really trying to be problem solver and not really a good listener and not really emotionally connected. Yeah, everyone tells me that. Well, it seems like one of the ways that happens for you is that you tend to intellectualize. Can you see that? Yeah, now that you point it out, I can actually see that. And then we ask, do you think that's good for you? Do you think that's healthy for you? That you keep just trying to sort of look at the statistics of things every time something really bad happens? No, actually, I don't think. Maybe that's why I'm a bit depressed. And then now, together with the patient and the therapist, we can figure out how the defenses are affecting the person in their life. I really think that one of the main reasons that makes ISTDP so good is looking at these defenses and how they affect the person at their work, within themselves, in their relationships with other people. Why is my microphone all? Sorry, I'm just going to switch the side of that. No, I'm not. I really think that one of the main reasons why ISTDP is so effective is that they help people identify these defense mechanisms and how they affect them in their relationships with other people, in their families, with their co-workers, and throughout life. The third reason why I believe ISTDP is so effective is that it's intensive. It's that I in the ISTDP. It's an intensive therapy, and it's an intensive here and now oriented therapy. And what I mean by that is it's not the kind of therapy that just asks you to think back on things, reflect on how other situations affected you, but really looking at right now, here, with your therapist, what are the things that are coming up for you and how do those things affect you? So rather than talking about, have you ever been anxious in your life and what was that like? It notices if you're anxious with the therapist right now and asks you, you seem anxious right now. What do you think that could be about right now? Do you want to look at that with me here right now? And what the difference is between looking at the past and now is that when you're looking at what happens here right now with another person, it makes more sense. It's easier to process. It's easier for your brain to understand something that happens right now and gets looked at right now, as opposed to something that went into your brain, got recoded somehow, went into your memory, got mixed up with a bunch of other memories and feelings that you had in there, and then you're trying to figure it out some 5 years later. When we're doing here and now oriented therapy the way ISTDP is, it really helps us focus in on specific problems that happen for a person right now. And that's, I think, the third reason why I think ISTDP is an extremely effective therapy. Now look, I've talked about 3 reasons, but as you all know, I'm a big ISTDP enthusiast. It's a therapy that I use more and more, and I've found that more of the other therapies that I tend to use become very seldom that I use them compared to ISTDP. And I really think that it's worth a shot. So if you've ever thought about therapy, if you've tried your run-of-the-mill therapies, if you've tried your cognitive behavior therapies, if you've tried your mindfulness therapies, if you've tried your acceptance and commitment therapies, and none of them worked, there may still be a solution out there for you. Give ISTDP a go and see how you go. Now, I'm more than happy to make a lot more videos about ISTDP. Like I've said, it's my primary therapy of use. I'm happy to talk about it a lot more. Let me know if this video was interesting to you. Let me know what else you want to know about ISTDP, and I'm more than happy to talk about that as well. Comment, subscribe, press that bell button so you get updates, and yeah, just let me know how you go. And in these days of Corona, I really hope that you all take care of yourselves and take care of each other as well. It's difficult times, but if we sort of come together, not physically, but if we come together emotionally, we'll definitely pull through a lot better. Thank you very much, and I'll see you next time.